On this Tuesday night, cautious optimism about Canada's trajectory. More Canadians getting vaccinated could mean more freedoms this summer.
I am really hopeful.
Plus, Quebec unveils its roadmap to reopening. COVID-19 fears persist in Alberta's oil sands.
It's really cramped. You're basically back to back.
How some workers allege dangerous conditions. In the Middle East, calls for a ceasefire. Tens of thousands left homeless as both sides refuse to stand down. And the truth is out there.
When it gets right in front of me, it just disappears.
Why is the military finally admitting UFOs can't be explained?
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin with news about vaccines in Canada. Millions more doses are arriving and being administered, and provinces are quickly surpassing targets for getting Canadians vaccinated. That is not only protecting more people from getting sick, it is slowly boosting the possibility of a less restrictive summer. Over the last 5 days, about 380,000 COVID-19 vaccine doses were given on average each day. About 46% of Canadians now have had at least one dose. About 3.8% are fully vaccinated. The federal government has said before restrictions can safely begin to be eased, 75% of Canadians need their first dose and 20% must be fully vaccinated. Well, Chief Public Health Officer Dr. Theresa Tam says she is optimistic Canada could hit that target in a matter of weeks.
We're not quite there yet, but I am really hopeful because of how fast some of the vaccines are going into arms. It's imminently possible that in the next weeks we're going to get to that 75% plus 20%.
In Alberta, about 42% of people now have at least one dose, but community spread was so rampant there, almost 700 people are still gravely ill. Hospital ICUs have never had more patients. And in the province's oil sands camps, outbreaks are still spreading. Hundreds of workers have become infected, 4 have died. The workers live and work in close quarters, and some have told Global News they felt they were not properly protected from the virus. Heather Yourex-West has tonight's top story.
Given the risk, were you surprised to see that this was the layout for lunches and meal times at camp?
100%. When I arrived on site the first time, I was quite shocked.
This oil sands contractor, who we have chosen not to identify, arrived at Canadian Natural Resources Horizon mine site in late March, one of the thousands of tradespeople brought in by the company to help with a site maintenance project known in the industry as a turnaround. 3 weeks later, he says he tested positive for COVID-19. He's not sure how he was infected, but he says there were times at camp, including meal times, where he felt particularly vulnerable. Global News obtained 2 photos of a trailer 4 different workers say was used at meal times during the turnaround period at CNRL Horizon.
Like you saw in the pictures, it's really cramped. You're basically back to back. So you're sitting there eating your lunch, you're exposing yourself to everybody around you.
A spokesperson with Canadian Natural Resources said the photos sent by a worker to Global News indicate to us a room that was clearly closed and not for use. This configuration does not have sanitization stations, signage, and required distancing in place. Attached is a photo of a typical room that was used for lunch breaks during turnaround. Each lunch area is equipped with sanitization supplies, and the tables are set at a distance of 6 feet apart. But infectious diseases expert Craig Jenny says with what we know about the variants involved in this outbreak, there are risks associated with either configuration.
We do know that whether we term this an aerosol or whether this is droplet transmitted, it's moving through the air. And you know, I think people fail to realize that simply being 2 meters apart is not a bulletproof solution.
CNRL says all of its COVID-19 protocols were approved by Alberta Health Services. AHS says because the company's dining layout included tables closer than 2 meters, the site was told to stagger meal times so that only every other spot or table was occupied. Heather Yourex-West, Global News, Calgary.
Quebec's Premier has just laid out a roadmap to reopening. François Legault has some big goals for what he is calling a summer of freedom.
By the end of August, if we reach our goal of 75% of the population over 12 with 2 doses, masks won't be mandatory in most public places.
That is pretty remarkable. Mike Armstrong is following this from Montreal. Mike, what is the science behind the decision to begin easing restrictions?
It's almost part science, part sentiment. There's been real pressure on the government to start loosening restrictions. We've had some of the tightest rules in North America since the beginning. We've also had some pretty sizable protests. So there's been pressure to sort of let some of that pressure out. But also the science, the numbers do show that things here are improving.
It's not something you see on the streets, but they're feeling it in hospitals. It is the waning of the third wave of COVID-19. And for emergency room Dr. Gilbert Boucher, apparently wasn't that bad.
It was a breeze. I mean, we were worried about it. They made some radical decisions early on, and I think that's really shut down things.
That Quebec is talking about reopening has a lot to do with its number of hospitalizations. Tuesday, it reported 484 COVID cases in hospital. Other than a couple of days, Quebec hasn't been that low solidly since early October. As for that third wave peak, it was the lowest of any of the waves. And compare that to neighboring Ontario, its third wave peak was its biggest. One factor was vaccinations, and in particular, who was targeted. At-risk groups went first, then older people. Younger groups weren't a strain for the healthcare system.
Yes, there was some young people. Yes, they were getting sick, but the numbers never reach any high levels.
Quebec also put a focus on speeding up lab tests and rigorous contact tracing. It also tried to act quickly to stop outbreaks by shutting down schools and workplaces as soon as an outbreak was detected. Now, Quebec did do one thing no other province or U.S. state has tried, that curfew. Most of the province is supposed to be home and inside between 9:30 p.m. and 5 a.m. It's a blanket measure, but its impact was really on one group. It kept young people from getting together and spreading the virus.
It's really hard to show the effect, but those are the population that because of the curfew, we didn't see outbreaks. We didn't see them coming to the emergency all that much.
That curfew, some of the big news today. François Legault announcing that it will be lifted effective next week, May 28th. Also, the objective in Quebec was to have at least 75% of adults vaccinated with one dose by June 24th. That's the national holiday here in Quebec. The Premier is actually moving that deadline, not back, but up to June 15th. So there is some confidence there, Donna.
All right. Mike Armstrong in Montreal, thank you. As Canada gradually emerges from the third wave, public health officials worry highly contagious variants could still lead to more rapid spread. The big difference now is vaccines. They, along with public health restrictions, are having an impact. Canada's chief public health officer says the number of active cases in Canada is down 25% now from the peak of the third wave in April. As Eric Sorensen reports, that's raising hopes for an easier summer ahead.
As Canadians head outdoors for the summer and as vaccinations rise and COVID numbers fall, there is a sense that change for the better is coming. These three friends have all been vaccinated.
We think we still need to be really careful, but there's sort of a hopefulness in the air.
Miyu and Jordan are keeping to a small bubble, even as bigger gatherings push their luck.
It scares me a little bit, but I think we all know that there are rules.
We're certainly headed in the right direction across most of the country, but we're still in the midst of a third wave. We're just on our way out of it.
In a country as large as Canada, the third wave has hit provinces in different ways and at different times. In the biggest provinces, BC, Ontario, and Quebec, the third wave peaked in April, though in Quebec it was smaller than the second wave. In Alberta, Manitoba, and Nova Scotia, the third wave didn't spike until May, though in Nova Scotia it's the highest numbers they've seen in the entire pandemic. And what is clear nationally is that we have had 1, 2, 3 waves, and that the third wave is on its way down as we approach summer. But given what we've been through with this pattern, is there going to be a fourth wave in the months ahead?
Whether there's going to be a fourth wave, that is something, that I think we are grappling with around the world.
The so-called Indian variant and others that could yet develop are making health officials cautious about declaring that a finish line is within sight.
Last time we only got up to 2/3 of the way down the curve, and then with some relaxation of restrictive measures, we went back up again.
But even with variants of concern, infectious disease experts believe vaccines make any fourth wave much less threatening.
Yes, you're going to start to see more cases, but the number of people hospitalized will be proportionally much less. It's a load that our hospitals normally deal with in a late fall or winter basis, and it's not something you need to close the community down for.
Some epidemiologists see a type of normal returning this summer and lasting.
And with things opening up with vigor and permanently, probably in August and beyond. I expect schools to be open in September, and I expect every day to be better than the previous day. So the end is in sight, at least in this country.
Thanks to vaccines, many experts think a fourth wave will not bring massive lockdowns. So there is reason to feel some optimism.
I see a light at the end of the tunnel.
Eric Sorensen, Global News, Toronto.
There is more clarity tonight for Canadians who got the Oxford AstraZeneca vaccine as their first dose. Canada's Chief Public Health Officer says if Canadians want a second dose of AstraZeneca, they can get one if they give informed consent. For those who don't want AstraZeneca as a second dose, it's likely they'll be able to get Pfizer or Moderna, though research into mixing doses is still underway. In India, the number of active new cases is starting to decline, but deaths are still rising and hospitals are still swamped. Today, the deaths of more than 4,000 people were reported, a new single-day record. India has now surpassed 25 million cases. Many states continue to have limited vaccine supply, even though India is home to the world's biggest vaccine producer. Today, the Serum Institute of India said, "We have never exported vaccines at the cost of the people in India." It says it plans to scale up manufacturing and prioritize domestic distribution, but its deliveries to the UN-backed initiative known as COVAX will be stalled until the end of the year. That is a significant setback to global efforts to supply vaccines to low-income countries. Tensions remain high in the Middle East tonight. There were huge protests in the West Bank in support of Palestinians and the mounting loss of civilian lives. In Jerusalem, demonstrators were met with gunfire. It was the first time Arab Israelis held a general strike like this in decades. In the West Bank, Palestinians declared a day of rage. Israeli police killed at least 3 people during these protests. Israel is carrying out more airstrikes on Gaza tonight, and Hamas is firing more rockets towards Israel. On the ground in Gaza, life is a nightmare. Our Redmond Shannon spoke with Gazans living in the line of fire.
Craters and debris, the aftermath of another series of airstrikes in Gaza. This man says he and his family got a phone call to evacuate before their apartment building was destroyed in a bombing.
We have been living like in a horrible movie.
Noordine Jamal and his family temporarily evacuated their apartment after a false alarm on Sunday.
My sister, she keeps clinging to me each night, because she is scared of the Israeli bombings. I see a harrowing scene in her eyes. It's unbearable.
The UN says 52,000 people have now been displaced in Gaza, many taking refuge in UN-run schools like these.
In some cases warned them, they've protected their life, but now they're homeless and need to completely rebuild their life.
Many essential services have been hit. Gazan officials saying their only COVID-19 testing lab is out of service.
We use the term war when two countries with equal powers are fighting. We are not equal with the occupation forces.
Palestinians in the West Bank and Israeli Arabs observed a general strike Tuesday in solidarity with Gaza. But the rocket attacks continued into Israel too. 2 workers from Thailand killed on a farm not far from the Gazan border. Israeli Prime Minister Benjamin Netanyahu visited troops at an airbase Tuesday, maintaining the airstrikes will continue at least until the attacks on Israel stop. Prime Minister Justin Trudeau has joined the Biden administration in calling for a ceasefire.
I think it's important to note that we are engaged in quiet but very intensive diplomacy.
Late on Tuesday, there were some optimistic news reports out of Israel about a possible ceasefire deal later this week. Redmond Shannon, Global News, London.
The path to a planet with far less pollution. Coming up, a bold roadmap to net zero from an agency that used to ensure a steady supply of oil. There is a landmark new assessment from the organization that has spent decades securing oil supplies around the world. The International Energy Agency now says investing in new oil, gas, and coal projects must stop if the world is going to reach net zero emissions by 2050. And it has a roadmap on how to get there. It says the energy sector, which produces about 75% of greenhouse gas emissions, must undergo a complete transformation of how we produce, transport, and consume energy. That means an end to new oil and gas field development and no new coal-fired power plants. An end to the sale of new internal combustion engine passenger cars by 2035. An immediate and massive deployment of all available clean and efficient energy technologies, and rapidly scaling up solar and wind, making them the dominant energy source by 2050. An unparalleled increase in global energy investments, rising to more than $6 trillion by the end of this decade. That could create millions of jobs in the clean energy sector. The International Energy Agency is not an environmental organization. It was formed after the oil crises of the 1970s, and its reports and forecasts are frequently cited by energy companies and investors as a basis for long-term planning. Ahead, the potential of mRNA vaccines goes far beyond protecting us from COVID-19. Canada has to rely on COVID vaccines made in other countries. Today, the federal government announced it is investing $200 million in an Ontario company to expand its plant and make mRNA vaccines here, though it won't be complete until 2024. mRNA vaccines, the ones Pfizer and Moderna make, are built on decades of research but had never been successfully developed until COVID-19 emerged. It is a huge scientific breakthrough, and as Jamie Maracher reports, it has other potential applications.
In a lab in Vancouver, scientists at Acuitas Therapeutics have been tinkering with mRNA technology, helping to craft the Pfizer and BioNTech COVID-19 vaccine.
We provide a delivery technology, tiny lipid spheres that protect the messenger RNA.
A blueprint for your cells, messenger or mRNA, instructs them to make a specific protein found in a virus. In SARS-CoV-2, for example, it's a spike. Ultimately, after an injection, your immune system should recognize it and build antibodies, fighting the virus off.
I think it is a real game changer.
Scott Halperin, the director of the Canadian Centre for Vaccinology, says what makes mRNA so useful is its versatility.
Very easily, you can change the genetic code and make a protein from a different virus.
Applying this to the flu, HIV, Zika, or even cancer, a disease the World Health Organization estimates killed close to 10 million people last year alone.
Cancers also express proteins that are abnormal that we're trying to evoke an immune response to in the body, and so mRNA technology could be applicable there.
Back in Vancouver, Thomas Madden says his company has already seen some successes combating rabies.
Certainly there's excitement about trying to apply the mRNA vaccine technology to some of these more challenging diseases.
But first, scientists say we need more information, noting the need for long-term studies and data into the longevity of mRNA vaccine protections. Donna?
Jamie Maracher in Toronto, thanks. Unidentified but not unimportant. Next, why the U.S. military is taking UFOs seriously. There's a change happening in the way one of life's biggest mysteries is being handled. The U.S. military now acknowledges some strange objects seen flying through the sky cannot be explained. We call them UFOs. The Pentagon calls them unidentified aerial phenomena. And as David Aiken explains, a report on what's known and not known about them will soon be given to Congress.
Day after day for nearly 2 years, U.S. Navy pilots would encounter this unidentified aerial phenomena, or UAP, while flying off the coast of Florida.
I don't see an exhaust plume.
No exhaust plumes, no markings, no wings, but caught on a U.S. Navy camera in 2014 and verified this year by the Pentagon.
Well, there's no question that this is really attracting a lot of attention. The videos can be interpreted in a lot of ways. We simply don't have enough information or all the information to really evaluate them. But the experiences that are reported by the pilots are something else entirely.
Indeed, that's just what a former U.S. president said Monday on a late-night talk show.
There's footage and records of objects in the skies that we don't know exactly what they are. We can't explain how they moved, their trajectory.
And these sightings are more common than you might think. In 2020, the year of the pandemic, Canadians reported more than 1,200 UFO sightings. That's almost 3 a day, a nearly 50% increase over the number of sightings in 2019.
People perhaps were spending more time outside their homes looking up rather than inside venues, being able to see the sky a little bit more, spending more time to appreciate what's up there.
But it is accounts from reliable sources like those U.S. Navy pilots that have authorities taking UAPs and UFOs more seriously than ever before.
There was 4 of us in the airplanes literally watching this thing for roughly about 5 minutes.
So your mind tries to make sense of it. I'm going to categorize this as maybe a helicopter or maybe a drone. And when it disappeared, I mean, it was just...
So I go like this, and it's climbing still. And when it gets right in front of me, it just disappears.
Next month, U.S. national security agencies will provide more information about what's out there, with some unclassified reports delivered to the U.S. Congress. David Aiken, Global News, Ottawa.
And that is Global National for this Tuesday. I'm Donna Friesen. Tonight's Dear Canada is this herd of clearly identifiable deer near Courtenay, BC. How do you compliment a deer? You fawn over her. That's all I got tonight. Thanks for watching. See you here again tomorrow. Take care of yourselves. Bye-bye.